slides. So it's mainly just to kind of introduce what we're going to talk about today. So just bear with me while I multitask on a tiny screen. Sorry. But I'll just a really quick introduction to the session that we have today, because we've got 3 or 4 rather amazing speakers who will be sharing about different projects in the Borough. And the theme, sorry, I'm just going to go into presentation mode. The theme for today is focused on maternal mental health and well-being, or women and mothers, and the different projects that are ongoing in the Borough that aim to do that in a trauma-informed way. And just to shout out that our next session is in June, on the 15th of June, and it'll be focused on different projects that are ongoing in Tower Hamlets, focused on working with different parts of the LGBTQ+ community in the Borough. So we'll be hearing from Ameena and Ruqayyah from Sister Circle, then Reean from the Family Nurse Partnership, and then finally Farah, who is an author as well as working with Women's Inclusive Team. And I think we'll hopefully have time for discussion throughout and also afterwards. And then finally, just a really quick intro. I actually won't go through this because it's a lot of text, but there is a report, or like a kind of like a manual, that the Center for Mental Health and Mental Health Foundation have produced through like evidence review, but also working with women and field experts on like what trauma-informed services or work looks like with women specifically. So I can send that out after the meeting, but I won't go through it in detail. So I think, oh, Farah, you've got a hand up.
Oh, I didn't. Sorry, I think that was from before when I was just checking.
Oh, okay.
Or something. That's historical. Sorry.
All good, no worries. Okay, well, without further ado, I'm going to hand over to Sister Circle so you can start sharing your screen and taking it away.
Oh, you're on
Can
mute,
you all see the
Ameena.
screen? Sorry. Can you see the screen?
Yeah.
We can. It's if you want to put it in presentation mode, it can be bigger. There you go. Thanks.
Is that better? Yeah. Okay. So firstly, thank you, Angela, for inviting us into the group to talk about our work. And it's really apt because it's around maternal mental health, and that's kind of, what we do day in and day out. So hopefully we can just shed some light for those in the group that don't know about us. But we're Sister Circle. We actually just went through a brand relaunch 2 months ago. We were formerly Women's Health and Family Services, so some of you may know us as that. Well, Sister Circle, or Women's Health, or whatever the name was before that, were founded by these wonderful women in this picture some 40 years ago. It's quite a diverse group of women that came across and realized that there was no kind of support for them around maternal care, or not in the same way that they'd kind of used to or culturally kind of are aware of or experienced in their own countries. So they decided to come together and start supporting each other, and hence the whole network of women started to form. And what's interesting is in one of these pictures, it's the grandmother of one of our trustees. So that's a real honor for us to kind of, have had that full circle, and women still being involved in shaping our work. So we're a community health charity, and we're based actually in Tower Hamlets in the Brady Arts Centre, which is quite a vibrant centre. A lot of activity happens there. But we also work across other boroughs into Newham and Waltham Forest. And our work really focuses around health and empowerment issues for disadvantaged women and their families. What shapes our work, I guess, is our, values. We're courageous and, committed to supporting and enabling change, mainly by listening and being resourceful, and also trying out innovative ideas. We hear from our beneficiaries all the time around different ways that we can improve and do things differently. So we don't shy away from trying new things. We're inclusive and we celebrate our differences, and trusting when we're thinking about partnerships, not just the women that we're supporting, but also, you know, other partners that we work with, having really open and honest, transparent discussions. You'll see about our values, they're really very much geared around some of the trauma-informed principles, the 6 principles. And we're really passionate and committed to learning and improving, and we've kind of found different ways of doing that rather than just standard feedback at the beginning and the end. We also kind of have a very vibrant WhatsApp group where lots of information is shared. I guess as a charity and our focus of work, you know, we can kind of put it into 3 main streams. I'm going to let Ruqayyah talk about the Maternity Mates programme, especially because she's very much involved frontline and, you know, working with all the staff involved in that programme. And then I'll come back and speak to you a little bit about what comes under the Healing Conversations and her health. Is that okay, Ruqayyah? I'll pass over to you just for the Maternity Mates part.
Perfect. So the Maternity Mates programme originally started in Tower Hamlets in 2010, and since has expanded out to Newham and Waltham Forest. The main goal of the Maternity Mates programme is to sort of provide support, one-on-one support to women who may not have access to it or have access to things that would make their pregnancy journey a lot easier, or really just even the playing field for them a bit. So the way the Maternity Mates programme works, we receive a referral from health professionals, professionals in the community, or even self-referrals from women themselves, to sort of at 5 months of pregnancy. We then match them up with a volunteer that we train in-house for antenatal birth support and postnatal support. These things can include going to appointments, helping with paperwork specific to like the pregnancy and birth and everything, attending the birth if she hasn't got a birth partner or needs a bit extra support during the time, during labour. And then postnatal support focuses around mums bonding with baby and breastfeeding and going to children's centres and further appointments that may follow that. The support postnatally lasts about 12 weeks, between 6 and 12 weeks. We do have a pilot at the moment where the support actually lasts from date of that we match them 18 months. So that basically brings you up to around baby's first birthday, which basically allows us to see how mums are bonding with their babies and where they may need extra support. That's really very much Ameena's kettle of fish there. The Maternity Mates programme has been going, and it's very successful in the areas that it operates. We work mainly with the Barts Health hospitals, so Whipps Cross, Royal London Hospital and Newham University Hospital. I am the programme coordinator for Tower Hamlets and Waltham Forest, and my colleague Livia is the programme coordinator for Newham. And yeah, we work with a lot of very local women who want to volunteer, and then we work with a lot of women who may require our support. And in addition to the one-on-one support they receive, we also are responsible for making referrals to them and ensuring that any additional things that need taking care of in terms of providing for their baby, getting things from baby banks or funding, we can make referrals to that and make applications. I'll pass on to Ameena to talk a bit about our other programmes as well.
Lovely, thank you, Ruqayyah. And if there's any questions, we're happy to answer them later, because it's really difficult to cram everything in the time that we have. We can talk passionately about it for ages. Okay, so we've got like the her health side of our work, which really focuses around FGMC, so female genital mutilation and cutting. We have advocacy clinics in Mile End, a pregnancy and a non-pregnancy clinic, and we have advocates there frontline working alongside the consultants, so they get support from the very beginning. into whatever direction that they want to take that. We also have something called the Conversation Cafe, where women can come and receive support and education, and just a safe space for people, women to come together and discuss the issues that are affecting them. They tend to happen monthly, across the borough. We kind of try and get into community centres and organisations to make it accessible for local women. And then the healing conversations part of our work is around counselling and providing support primarily for FGMC practicing community. Like just to talk, I just have again space for any healing or recovery work that women might want to engage in or feel they're ready to engage in. So we have the counselling service that offers 22 sessions for free, and that can be done in person or online in a range of different languages. So that's quite accessible for women. The counselling also extends to our volunteers who are sometimes working in really complex situations, or may have experienced like a traumatic birthing experience with a woman and might need to have a space to debrief and discuss what's come up, or it might have triggered something. So we do extend our offer to staff as well, and the women that are being supported by the maternity mates. And then we also now are in a pilot working very closely with them, or in partnership with the Ocean maternal mental health teams, to provide peer support, group peer support in the community in Tower Hamlets, New and Waltham Forest. So that's kind of, what underpins really our work is the women's voices. Like, a lot of our work is governed and designed in a way that supports the needs, that are being presented to us. And we aim to take that and to places where we can also influence change and policy. So we've just talked a little bit about all of these programs. I won't go through this slide, but if you have any questions about any of the programs, then please do get in touch. And this session was meant to be around like trauma informed and what it means to be trauma informed when we're thinking about our services. And our approach fundamentally, is concerned about kind of creating conditions that would reduce harm and promote healing, especially for individuals who may have already experienced trauma. It can also recognise experiencing trauma in the past can affect the way a person perceives and responds to the environment in the present. And so this is particularly important, I guess, when we're thinking about service design, where we hear the term things like user involvement or co-production, and we're interested in people with lived experience being part of our service design. There is a danger there, of I guess re-triggering or unintentionally even causing distress and harm. So this is something very much at the forefront of our minds when we're thinking about doing a piece of work that involves co-creating with the community. And we do pay attention to the 6 principles, and I'm sure most of us in the group have probably come across those, like around safety, being trustworthy and transparent. We're very like an open book, our organisation. The CEO is often like sort of available, talking, making phone calls to the volunteers. It's very much a harbouring that kind of trauma informed approach all across our work. Peer support again is something that's very much I guess all of our programs are really dependent on having people with low lived experience and passionate about what they do involved, whether it's in service design or whether it's in the delivery, or just having a voice and coming together and just coming for a coffee and having a chat with us. Some of the kind of women that we support in Ruqayyah, I guess, comes across this, a lot in the assessments that she does and the referrals that she processes. Like the women that we are supporting may have experienced any one of these or a multiple, complex kind of situation, and quite a few of these situations. They might have had like domestic abuse, previous substance misuse. They may be quite isolated, new to the country, don't understand the system, or English not being their first language. We may have situations where they have had mental health challenges around panic attacks or depression, or even previous traumatic births. All of these are things that, you know, are really in our minds when we start engaging with the women. And when we're thinking about trauma-informed peer support, the way we approach it is like moving really from what is wrong with you question to what has happened to you, and allowing for that conversation then to, you know, evolve. And that's really, you know, what we're all about. So if there's any questions, you know, we're happy to answer them. I don't know if Angela, that's done now or in the discussion later.
We probably have time for one or two questions. If there's not any from the group, I did have one. But did anyone have questions for Ameena or Ruqayyah? Okay. I guess just before we go on to our next speaker, I know when we were discussing how we wanted to shape this session, we were talking about challenges or successes that you've had. And obviously there's been so much that is incorporated into Sister Circle already that takes a trauma-informed lens. Would you say that there's been any particular challenges to adopting or using trauma-informed ways of working in what you do?
You know, we've been doing this for so long, Angela, you know, and we may not have these labels and titles, but a lot of our work is around like holistic approach and really kind of having an open door policy where, you know, women can just come and anything can go. Like, you know, like the beauty of being, I guess, a community organization, there isn't so much bureaucracy and red tape, you know, they can just come and so this has happened and I need somebody to talk to, you know, like some of our maternity mates. It might start off quite simple, you know, as you know, with trust that doesn't come day one. You don't walk in and start opening up about your life, right? And so our approach has been very relational, you know, model from the very beginning. It's gentle baby steps, and Ruqayyah may do an assessment week one, you know, meet with the women, and very little has come out. But as the relationship with the maternity mate evolves, the maternity mate comes back, did you know she's experiencing this, or this has happened, she's disclosed this, and a lot of, you know, things begin to become unraveling. And we're able to step in, you know, we have kind of other streams of work that can maybe support or signpost or refer onto our partners and other organizations. So, you know, I think when we're thinking, the challenges are obviously there in that it takes time to build that trust. And, you know, so things might not happen so quickly, and we have to be patient and just go with it. And it's, again, it's about the choice. You know, women may or may not want to disclose and may decide to disclose to somebody and not to somebody else. So yeah, we've been doing it for a long time. We wouldn't say it's a challenge, other than like the challenge of finding the right support, you know, for the complexity of situations that are coming our way, you know, or timely support. You know, everyone's aware of like the housing situation. We have women in hotels, you know, that are then rehoused, that set up their, you know, support systems where they're with their maternity mates, the children are in school, they're building their, you know, network of support, and, you know, they get a phone call next day, they've been moved up country, starting it all over again, not knowing anyone. That trauma, you know, they're just reliving that trauma. And so that's for us a challenge emotionally for our staff, for us. And, you know, yeah, it's just, yeah, that's the hard part of it.
That the environment doesn't necessarily cooperate with what you're trying to work with. Thank you. I feel like there's probably a lot of like things to take away from that So thank you so much. And we may have more questions later on for you. So I'll move on to our next speaker. So we have Reean joining us from the Family Nurse Partnership, and she is a family nurse. So over to you. Let me know if your screen sharing doesn't work and I have your slides, but otherwise it's all yours.
Thank you. Can everyone see the slides?
Yes, thanks.
Great, thank you. So just a background on who we are as family nurses. So we're all midwives or health visitors. And we are an intensive home visiting early intervention programme. Our eligibility criteria is first-time parents, age 21 and under, but we do go up to age 24 if there are any additional vulnerabilities. We'd like to get the women onto the programme under 28 weeks pregnant, and we stay and work with them from pregnancy up until the age of the child is 2. We do weekly or fortnightly visits, or we personalise the visits to need. So sometimes some of the girls on our programme may not need such intense visits, and we can personalise our visits to their need. So last year, 22% of the referrals that we received into F&P were aged 18 years and under. And of these, 42% were aged 15 to 17-year-olds. We have a caseload of up to 25. And as well as being nurses, midwives, health visitors, we also have to undertake specialist family nurse partnership training. So the F&P programme has developed over many years to become an F&P based evidence-based programme, and it's offered to families in 7 different countries. And the key features of the programme that need to be adhered to faithfully to reproduce the programme model that has been rigorously tested are called core model elements. And some examples of this are the mothers being enrolled by 28 weeks, and family nurses to complete all elements of the learning programme, which includes trauma awareness training. We also have weekly supervision, monthly psychology consultation, and adhering to these protects the integrity, quality, and the effectiveness of our programme. So the F&P service and the tools that we use, as previously mentioned, the Family Nurses Learning Programme includes being trauma awareness and trauma practice. F&P is a relational programme, and the therapeutic relationship is integral to delivering the programme. Our F&P communication skills are based on motivational interviewing, and having one-to-one supervision with our F&P supervisor weekly allows us to discuss cases that we may be having some difficulties with working with some of our girls, or it helps us do things like skills practice, which allows us to step into the shoes of our clients, which helps us to be more empathic and work with them better. Our monthly group psychology consultation with the clinical psychologist allows us to come together as a group of family nurses and discuss cases that may have some themes that run throughout a lot of our other clients as well, which really helps us as a team. So some of the tools that we use to help us with our clients are, this is one of them, and it's a baby's family tree. So it's an easier way to do a genogram for us. And what this helps us to do is understand the family and the potential trauma and explore it sensitively without being very directive and asking personal questions. So we're really mindful and sensitive as to not to re-traumatize our clients. So that's one of the facilitators we use. Another one is my life history and my life history calendar. So these two are the same. It depends on the client that we're working with, depending on which one we will use. And it helps us kind of have a look at their journey, and they can write on it. We don't ask any kind of leading questions. We allow them to disclose anything that they would like to disclose. They use different colours. Some people draw pictures, some people will tick boxes or write in different colours things that have happened on their journey in their life, things that are important to them and that they feel may impact them as they take the journey into parenthood. So, as family nurses, we understand that relationships are key to healing trauma, and sometimes the girls that we work with haven't had good relationships in their lives, and this kind of helps us figure out what was going on into as they were children, sort of into kind of teenagehood, which helps us to plan further for them. We also have My Village and My World of Support. And this is just another facilitator that we use to get a good idea of the family and the support that the mums have and who will be there to help them as within family, friends, or whether that's professionals. It just gives us a good idea on who's in their life. So F&P allows young parents to build positive relationships with their baby and to understand their baby's needs. We make to make positive lifestyle choices that will give their child the best possible start in life, build their self-efficacy, and build positive relationships with others, modelled by building a positive relationship with the family nurse. So the challenges when trying to apply trauma-informed approaches, our program is intense and it can feel threatening to those who have a history of trauma, and this can be challenging when trying to build a relationship. Our work is mostly done within the home. We visit them weekly to 2 weekly, and sometimes some of the girls we work with um, they're unsure of what it is that we want from them, and that can be quite challenging at first. So this being directive and the safeguarding concerns. So when there is safeguarding concerns, we do have to be directive with some of our girls, and we are mindful that we don't want to re-traumatize them or make them feel that they're not doing a good job. And sometimes that can be a challenge, especially when there is safeguarding concerns involved. Sustaining engagement for 2.5 years can be difficult as well, especially if some of our young mothers do have relationships in the past where they end quite abruptly, or they're not used to the intensity. They might find it overwhelming. So trying to sustain the engagement can be quite difficult. And working with the wider family and understanding the dynamics within the relationships. As I said, our work is primarily in the home, and sometimes, depending on the age of the mum, maternal grandmas are working through their own trauma. So we try to think about how we can not only work with the young mother, but also how we can work with the family. And some successes when trying to apply trauma-informed approaches are the F&P program in general and the core model elements, which helps us to deliver a successful program. The access to training that we have, we've recently just done trauma-informed training with the Wave Trust, and we've previously had the opportunity to do the Karen Treisman training. We have strategic oversight and the training program by the Family Nurse Partnership National Unit and the F&P supervision model. On a sort of more personal level, in terms of successes with clients, I have a young mum that I'm working with currently who, a bit of history, she was removed from her birth mother at the age of 2 to 3 years old and was placed in care. She went to various different foster carers and was adopted at the age of 5. So she had lots of kind of moving from house to house, lots of abrupt endings. She was adopted at 5 and then she was placed back into care at 15. And I spoke to my supervisor about this and had one-to-one supervision with her because I noticed that she had a problem with goodbyes. Endings were just not good for her. So me and my supervisor did skill practice, and having stepped in her shoes, I realised that goodbyes and endings were really traumatic for her. So having done that, I went back and created this, which is a countdown to her graduation. So she's ending the program in the next 6 months. And having the supervision and being able to understand that endings and goodbyes were really traumatic for her, I was able to go back, look into the facilitators that we had, plan positive endings, and have the conversation with her on how to say goodbye, how to end, and give her examples of what a positive ending looked like, which she really appreciated, and it helps us move forward as she finishes the program. And that is it from me. Is there any questions?
Thank you so much. That was
worries.
brilliant. Does anyone have any questions for Reean or about the F&P program, or any comments from Patricia?
Hi, I don't think I have a question, although it might turn into one. I just wanted to thank both presentations. I think what really clearly came through for me was actually trauma-informed care or trauma-informed approaches in action, the reality of it. I think quite often we talk about it as an abstract idea. So the kind of very concrete example that we're just given. But also I think the really important point about actually trauma-informed approaches aren't anything new. That many services, and I think particularly community services that have grown up out of what people need and what matters and what means to people, have been doing this for years. And I think we should never lose sight of that. That we might have a kind of a current term for these kinds of things that help people. But there's a lot of knowledge and experience in our communities and in our community services that we can share the learning. So I just wanted to acknowledge that and thank you for sharing what you are
Totally
doing.
agree. And it was something that we've been talking about. I think a lot of people will know Alison Robert, who's like, she works for the Tower Hamlets Council for Voluntary Services, about how we showcase and bring in more people in community organizations, because there is so much to, I guess, from a learning perspective, but also from a like sharing, because there is lots of great work happening. So there probably will be more discussion points that come up after our next presenter, who is Farah. So over to you, Farah.
Thank you. Let me just bring the presentation up. So I'm just looking for the actual PowerPoint to...
All good.
So share entire screen. Okay. Presenting. Okay, so can everybody see now?
Not yet.
No?
Are you sharing your screen?
Trying to. Maybe not. Maybe I'm not doing it. Okay, let's try again. Okay, sure.
Oh,
Is it come up
now
yet?
it's things are moving. Yes,
On.
we can see your presentation.
Yeah, it's all there. All right, fabulous. Thank you for your patience, everyone. Hi, everyone. So I'm Farah Dualeh. And if you can hear me at any point, just let me know. My name is Farah Dualeh. I work for a charity called Women's Inclusive Team based in Bethnal Green. And we do a lot of work there, mainly with women, a lot with mothers, also youth. And we have various projects around advice and guidance, around employment, but we also have some other projects around health. And I'm just going to be talking to you about one of those projects today called Flourishing Communities. And for anybody who's interested in the report that we did on that last year, I can also share that with people afterwards, or maybe send it to Angela. I'm also an author of a book called A Muslim Woman's Guide to Surviving Infertility. And so for today's short talk, I will have both hats on, and I will be trying to talk a little bit about what we do when it comes to thinking about being more trauma-led and trauma-informed led in our work. So I will have both hats on. I'll be going back and forth. So like I said, there are two things that we're working on today that I'll be talking about. There's a project, Flourishing Communities, and there's a product, which is this book called A Muslim Woman's Guide to Surviving Infertility. In terms of the project, it started off as a pilot last year, and then thankfully was funded for a further 3 years. And we are at year 1 of the main funding. In terms of the people involved, the key partners include Hamlets CVS, so Alison Robert that you just mentioned is a key person in this project. Women's Inclusive Team, so the organisation that I work for, the GP Care Group, Queen Mary's University, for this year's cohort Limehouse Project. And also Soul Sisters were heavily involved in last year's, not Soul Sisters, Sister Circle, sorry, your new name, Sister Circle, were heavily involved in that last year as well as the women, the community. So I will talk a lot about how the women played an instrumental part in this project. In terms of its aim, the project, it aims to improve access to health for women from ethnic backgrounds, from marginalized backgrounds, and it focuses heavily on reproductive and sexual health of women. But in particular, we are doing a lot more work around cervical screening. When we say reproductive health, we are focused around pregnancy and labor. And for this year, we are focusing on menopause. That will start next year, actually. Menopause is also a new thing that the women said they wanted to know a lot more about. In terms of the other hat that I have on, which is the book, being an author of this book. This book is for Muslim women and Muslim couples, and it's a project that I felt was needed, which tries to provide a lot of support in terms of practical support, in terms of emotional support, and in terms of spiritual support for those suffering with infertility and struggling to conceive. So in terms of thinking about being trauma-informed approach, it's really, really interesting that I know somebody just made a comment now that this is nothing new, something that's been happening for a very long time. And for many people, the nurses, the midwives, and even staff at places like Sister Circle are a lot more experienced in understanding and implementing this, a lot more than, say, ourselves. So for us, I will say, in a lot of spaces in the third sector, but also for our organization and for myself, these are new terms for us. So whilst I understand it's not new in terms of it being practiced in many spaces, it's new for us. Not necessarily in the fact that we deliver it, but we just deliver it so naturally in the work that we do that we don't always know these particular terms to attach it to. So for me, I wanted to highlight my understanding of it, which is when we're doing work, it's a non-judgmental and compassionate attitude towards service users' experiences. And so how have we been able to do that? And how have I been able to do that in the two areas that I discussed? Well, the approach has been that the women are always involved throughout. in terms of flourishing communities, it's actually the community themselves. We have a steering group. We have women from the Bangladeshi community, for example, the Somali community, which were some of the key communities that we're working with, who tell us what they want to focus on, who tell us their stories and their pain and their history, the solutions that they want to, you know, see, especially within the NHS system and things like that. And so it's making sure that the women are through anything and everything that we do. And in terms of the book, the first page of the book says, you know, dear sister, this is almost like a love letter. It's a very personalized approach into writing something that really captures a lot of the trauma, a lot of the isolation that infertility can have for some people, and especially certain communities. And so that's the thing where it's them that are essentially leading the work. So when it comes to the project, some of the ways that we made sure to do this and that we really tried to create those safe spaces that we talked about and somebody had mentioned earlier is making sure that we remind and encourage the women that we're working with that they have a choice. They have a choice to operate and to continue in the way that they work with us and the way that we work with them, that takes into account their own subjective experiences and their own history and what they're going through currently. Some of those choices that we've talked to them about is around service. So for example, cervical screening, we encourage women to attend and we tell them that it saves lives. But ultimately, we also tell them that they have a choice to opt out. If it's too much, if it's something that they feel like they can't do, they do have a choice to opt out. So we make sure that they understand that they have their choice all the way through. They also have a choice in the person that they, for example, if it's accessing maternity, whether it's accessing cervical screening or anything else, they have a choice in the people and the persons that they work with and that work with them. So for example, if they want a different gender in terms of the healthcare professional that's helping them, or if they need an interpreter, or if they want a family member there, it's about them understanding that they have a right to have these things that might make them feel more comfortable, safer, and ultimately able to access better care. And in the same way, place, you know, we remind them they do have a choice in where they can have a baby, where they can have their child, how, you know, other clinics that they may want to tap into for other services. And all of that means that they are feeling heard, they are feeling safer, and that we are making sure that we don't try and just give a blank statement of how they should access these services. In terms of the book, again, choice is all the way through, and it talks about choice in terms of treatment. Not every treatment is for everybody. So that's really discussed in the book, what treatment is right for you and how that might be, and the ways in the ways that somebody might be able to get to that decision, who they share their fertility or infertility journey and how much they share, reminding them that it's their journey, it's their choice, and it's they have the power to share when they want to or when they don't want to, and also how they process through it ultimately. The way, the choices that they have in what their families can look like, the choices that they have in however they want to kind of survive and thrive through this difficult challenge, I guess. And apart from choice, the other thing that we really utilized in the Project Flourishing Communities, but also in the book, is that it really does come down to being person, but more particularly more female-centered care. So for example, again, I gave cervical screening as an example. And when we remind women that they can say that they're able to tell somebody or the nurse to stop at any point, if they're feeling pain, if they're feeling discomfort, if they want to ask questions, whatever it is, they can stop at any point. And just making sure that in whatever area of their health and their life in general they're talking about, that we value their subjective experience and that they feel heard. And we can see the work that we do that does wonders, just like somebody else was saying before. And in the book, again, it being really person-centered and female-centered is around the kind of chapters in the book include things like womanhood and identity, and just kind of reminding the reader to find a way, or to try and find a way to separate the person and the trauma, and for them to know that, you know, their self-worth or the way they're feeling about something, on all of these things are not controlled by, I don't know, a diagnosis of infertility of some sort. And and ultimately that they have a right to feel and do what is right for them. And so through all of that, you see that, and I've seen firsthand when it comes to the book, for example, that women are feeling like their stories have been captured. So I wrote this book because my husband and I have gone through infertility for many, many, many years. And I wrote this book with a lot of my experience in it, but thinking about them. And by reading it, women from around the world have told me how they felt like they'd spoken to me, that I had interviewed them for this book, because they found themselves and they found their pain in the book. And then they were able to make better decisions that felt more inclusive of what their needs were. And finally, one of the other things that we've been able to do in flourishing communities, but also a little bit in the book, is training and information. It's around providing the right training to the people that we're working with, women and mothers in this case, to understand how to better access health and how to better access services in a way that is suitable for them. And so allowing them to understand what it currently is, and then starting to understand how they can tap into that and what areas don't make sense. And we were able to do that because culturally, so Women's Inclusive Team, because of the organization that we are, we work predominantly with women. We work predominantly with Black and women from other ethnic minorities. We work predominantly with mothers. And because of that, there is a cultural understanding, which means that we approach how we work with them in a way that they're able to engage with the work much better than when other people are, or it's delivered in other spaces. And again, I know I've been using cervical screening as an example throughout, but again, training around cervical screening has meant that their understanding of why it's needed, and how things like FGM, I know FGM was mentioned before, and because that's one of the traumas that a lot of the women talked about, and it's one of the reasons why they've stayed away from things like cervical screening for a long time. With the right training and with the right compassion and the right understanding of their needs and listening to their stories, it's meant that a lot more of them have felt comfortable now to access those services. And for the book, similarly, it's around providing information in a sensitive and informed way that has the patient and or the woman at the heart of it. So when it talks about counseling or IVF and all those kind of things, it's with the idea that we have to take into consideration the trauma of fertility or infertility in itself, as well as other personal and past traumas that somebody may have gone through. And so briefly, I'm nearly done, but briefly, some of the challenges that we found and some of the outcomes that we've been able to achieve, I've just highlighted here a little bit. So in terms of challenges, when it comes to the project Flourishing Communities, we found at the start that the women that we were working with were very reluctant to voice their negative experiences to professionals. They would tell us, but they didn't feel comfortable complaining to the professionals. So we had maternity became a massive topic that was a real core issue for a lot of the women. And they talked about when they would have their child at this hospital or that hospital, how this happened and how that happened. And then when we say, did you complain? Did you follow that up? They usually said no. And it was because they often felt like that it would come back, that they would be penalized for it in some way, that they would be seen as problematic. And so we've realized that when there was a stage in the project where we try and bring the professionals and the community together. And at first there was a reluctance, but then thankfully, with the right trust and the women bit by bit understanding the need, but also understanding them feeling safe, meant that when we did finally get to that stage, they were able to talk a lot more. There was also resistance, like I said, to a lot of the women going for their cervical screening and things like that, like I said, due to past traumatic incidences such as FGM and ongoing, I guess, something like that is, ongoing. And for the book, a lot of things that I saw, some of the things that I saw is that there was a lot of shame around infertility or diagnosis like PCOS. So for a lot of these women, there was a lot of shame, which meant that they were trapped in their own fear around accessing support, around talking about it, or finding like-minded people that they could get that support from. That was some of the challenging that we saw in the project, as well as I saw in writing the book and speaking to people about the book. So in terms of what we've been able to achieve, is because of that trust. So for example, like I said, the book, instantly there was trust because I poured my story into it and I poured my own challenges and my own traumas into this. Women were able to see themselves in it and they were able to access the support without having to share theirs in public. And that did a lot to really like dismantle a lot of the shame and a lot of the loneliness, I guess, for a lot of people. In terms of the project, that being the right person and the right space and, you know, with the right approach, that trust has been built previously and continues to build. And I won't go into them now. I'll probably send it to Angela, who can share it with people if they want to. There were some case studies that came out of that. So maternity, like I said, was a massive, massive issue. And one of the things that we did was that an incredible midwife from Royal London Hospital actually came to our community centre once a week for a certain number of months, so that our community people that we work with and the women from our project were able to book an appointment with her, were able to have a one-to-one with her, and they were able to then find out if they can get support around some of the negative experiences that they had. And there's a really, really case study on that where a young mum came to this clinic 1 year after giving birth where she had a horrific experience. And because she was able to have that conversation in a safe space, the issue has been escalated and it's been dealt with by the right people. Again, cervical screening, where we were able to tell people there's, you know, different size speculums and things like that. They were a lot more willing to go and a lot more women did go and encourage others to go. Another final example, again, I can share the case study, is a non-English speaking patient, an older woman living on her own, not speaking English, was, apart from her own personal traumas, she was really traumatized in accessing health, just from the GP level, from primary care. And because she didn't speak the language and she didn't have family members and people that could support, she felt humiliated every time she went to the GP. She felt like she was never supported. She was never given time to kind of explain what she needed in her broken English. And because of that, she disengaged from services for a very long time and only utilized herbal medicine and prayer. And then after this project, thankfully, 2022, we've got her back into the system of engaging with her GP, and she actually booked her breast screening for the first time ever, and all of these things because of the care that she was giving and because the space that her trauma and her own personal experiences had been given. And yeah, that's it actually. I think I finished. So that was a quick summary of flourishing communities.
That's all.
So I will stop there. And anybody, if they have questions, they can, go ahead.
Thank you so much again. And just really speaks to what Patricia was saying before about the wealth of knowledge and experience that exists in community organizations. We have about 15 minutes, so if people do have questions for the whole group or one particular speaker, please do so. I had a question, like a quick one, maybe for the FNP program. Is it the same, like the trauma-informed approach or like prioritizing that? Is that the same across all of FNP or just particularly in Tower Hamlets?
It's the same across all of FNP. So no matter what borough it is, it's the national unit that runs the Family Nurse Partnership training program. So it's the same for everybody.
Okay, that's good to know. Trisha.
Yeah, I just want to kind of come in after that. I don't know if you've worked in other services and other roles as a nurse, and if you what differences you see from maybe other teams that you've worked in that haven't had this sort of training and framework.
I worked
does it make a difference? Because that's what I'm saying.
Yeah, so I worked as a health visitor prior to being a family nurse for 3.5 years. And if I'm completely honest, trauma informed wasn't really something that was spoken about or discussed back then. And this was only, in 2015. I think I graduated as a health visitor and worked there for 3.5 years, but it wasn't high on the agenda at all at that time.
Brenda?
Sorry, I just want to clarify. I just wonder what differences you see from that approach.
Now,
Yeah.
I suppose this role's a lot different to my role as a health visitor, but the difference is, I guess, we get to hold, I get the space to hold these girls in mind, and I have the time to work with them in a way that I guess is conducive for both of us, but also I have the access to supervision, to psychology, to look after myself as a professional, to be able to deliver a trauma-informed service to the girls that I work with.
Thank you. And I think that kind of looking after or being looked after as a worker is such an important part of
Yeah, absolutely.
work. Yeah.
Brenda?
Over to you, Brenda.
You're on mute.
Yeah, it was, yeah, you can hear me now.
Yeah.
I mean, so I'm the supervisor in the Family Nurse Partnership, and I just joined the meeting a little bit later, but I just wanted to follow up on what Reean said. I think the beauty of the F&P model is the supervision. The work that we do with teenage parents is incredibly intense. A lot of them have had multiple adversities. And I think what I hear from the nurses again and again and again is how the supervision helps them to hold the complexity. But so I also have monthly supervision, and this is, Reean mentioned about the core model elements that are part of the F&P program, which really makes it trauma informed. So it's like the parallel process is going on between the mother and the baby, the nurse and the mother, the supervisor and the nurse, and then further on up when I have the clinical supervision further up. So this is the beauty of it. So often what's getting played out between the baby and the mom is then being played out in supervision. It's really quite fascinating. But yeah, so yeah, that's what I wanted to say about that. I have lots to say, but I mean, I think that really covers it.
Thank you. It's useful to picture that and how it all matters, that it connects. Ameena, you've got a hand up.
Yeah, I mean, just following on from what Brenda was saying, like, when you're working in such intense, like, emotional roles like this, whether it is in a professional capacity, but even in our voluntary sector, supervision, clinical supervision is a must when you're trying to work with trauma. And like the peer support group work that we do, and a lot of it's facilitated by lived experience volunteers, and we've completely understand that this is something that can re-trigger at any point. We never take it for granted, whether it happened like years ago, and whatever the journey has been, there's potential for anything to come up at any point, and to have systems and processes in place that kind of can support them ongoing is really paramount. So the peer support work, I didn't really mention who it was for, but it's for women who've experienced pregnancy loss, baby loss, or birth trauma. And so, women can be referred in for peer support to receive around 12 sessions.
It's really good that that exists. Thank you for adding on to that. We've got a hand from Meena.
Yeah, so I just wanted, can you hear me?
You were frozen for a second, but you're here now.
Yeah, I just want to say thank you to everyone who spoke today, because when my mum was nearly 40, she had a surprise pregnancy, and I remember it was really challenging for her, because she already had diabetes, and then it was a lot worse during the pregnancy. She had to change her diet. There was so much stuff that she had to change, and then my sister, who is now 9, had a heart condition. So I feel like this kind of service would have really helped her go through, because it's a lot for like any family to go through, but especially for the person who's carrying that child. So yeah, I just wonder if there's any kind of support specifically around, because I'm aware that like in certain communities where like things like diabetes is a lot more prevalent, like I'm Bangladeshi, so like I know that there are a lot of, it is very prevalent in my community and in my family. So I just wonder if there's anything that you guys do to sort of support people who maybe have diabetes or other sort of health conditions and then become pregnant, and if so, what that kind of looks like. Because I think there's also like there's a correlation with like trauma and then also having things like diabetes or other physical health conditions. And I think it's really easy to like just blame the ghee and the mishti and the sugar and all that stuff, but I think it's also part of it is to do with like traumatic experiences or adverse experiences that people have. So yeah, just wanted to know if there was any sort of support that you guys on that side. Hope that makes sense.
Or any Farah or Ameena or Ruqayyah or Reean, has that come up, either diabetes or other long-term conditions that people might have?
Ruqayyah, do you want to answer?
So the in the maternity mate support, because we are basically non-clinical and we're non-clinical sort of support, the support mainly revolves around the emotional and practical side of pregnancy. A lot of the support for women who may have gestational diabetes are mainly revolves around that of the support that they receive from their midwives, and then just sort of echoing that and helping them access additional services and support that may be specialised in that. So it's basically our job to just do the research and signpost that for them.
And I will say for us, yes, in a similar way, because our project Flourishing Communities is around capturing personal experiences of the women that we work with and then trying to kind of work with the system to kind of create change both ways. So yeah, in a similar way, we wouldn't necessarily be able to support them in the way that you might be mentioning, Tahmina. But I'm sure somebody maybe know who should be signposted to.
For us, we work with mums under the age of 21. However, we do have somebody on the programme that does have diabetes, I believe. And again, even though we are nurses, midwives, we just liaise with whether that would be the diabetic specialist, but also speaking to the mother about how she looks after herself, diet, nutrition, ensuring that she's keeping appointments with the diabetic nurse, but nothing particular in terms of support just for women with diabetes.
Back to Farah.
I just had a question once we've finished that. I don't know if anybody wanted to ask that.
I guess
that point.
I suppose just to wrap up around that point, it seems like it's one of many experiences people might bring that's separate to the current thing that they're trying to address in the room, but would still influence like how they're feeling or like how tense they might be about interacting with health professionals in general. So I think it is still important to consider those things. So thanks, Meena, for bringing that up. Over to Farah.
Yeah, so again, I have almost a similar question in the sense that for our project, so we have a little bit like what Ameena was saying before, where you have your own guiding principles that you work because of, that you use because of your organization. We have similar thing, and a lot of that then means that you are essentially being trauma, practice led, or whatever the term exactly is. But I wanted to know if we as in the CVS, Limehouse, WIT, the people that are working on this project, obviously none of us are we're not clinicians, we are not necessarily people that work with people that have high vulnerability generally. So we've never had this kind of training before. And I just wonder if anyone in the room is aware of someone that could maybe come to us and give us a short training where maybe we can improve some of the workshops that we're doing and consultations that we're doing and some of the work that we're doing with the women.
Do you mean training about trauma-informed care or
Yeah,
other
more,
aspects?
Yeah. So how we can improve the work
Okay.
that we're already doing and implementing that a bit better.
There might be, sorry, I'm just conscious of time. Two things, and then I think we'll have to wrap up. One, I think that there's a real opportunity from people in this room and maybe outside of this room where there's existing kind of knowledge sharing that could be done. So really practical things to incorporate into the work that you're doing. So I'm thinking like definitely working with Sister Circle or FMP to think about practically how to incorporate those principles into the way you work. But then also just more generally, there is training coming up that is available to everyone that works across Northeast London, which I'll circulate with the slides and recordings that go out after the meeting. And I think that should be offered this sometime in the summer. So stay tuned for that. Okay. And I guess does anyone have any concluding points before we wrap up this session? Brenda, you've got your mic off. It sounds like you might want to say something. No, okay.
No, sorry.
That's fine. Great. Brenda's got wave chess in the chat. Thank you. Yeah, so just I guess thank you so much for everyone that's presented. It's really clear that there's lots of great work happening that we can all learn from, even if we don't work in the maternity space. And so I'll be sending out the slides and the recordings after this. And yeah, thank you everyone for making the time to join today, and hope you have a good rest of your afternoon. Nice to see you all.
Bye.
Thank you.
Thank
Take
you.
care.
Bye,
Bye,
guys.
everyone.
Bye.
Bye.